Should marijuana be legalized in Connecticut? It's being talked about at the state capitol. With us now, Jason Ortiz. He's representing the Connecticut Coalition to Regulate Marijuana. Also, Ken Welch. He is representing Smart Approaches to Marijuana. Gentlemen, thank you for being with us here today.
Thanks for having me.
Mr. Ortiz, I will begin with you. Why should marijuana be legalized?
I think we should legalize marijuana so that we can stop arresting our young people and filling our prisons with nonviolent drug offenders and actually bring economic opportunity to a lot of places that don't currently have it. We're seeing businesses open and jobs created in other states, and I think it's time Connecticut join with the rest of the nation in progressing on our drug policy.
Mr. Welch, why should it stay the way it is?
It's a public health hazard, plain and simple. There isn't a medical organization out there endorsing its legalization. It's bad for families, it's bad for youth. I won't get into an argument about the economic support and or lack of support for underprivileged communities, but there's a lot of data out there that says those are the ones that are going to be targeted with the legalization.
Mr. Ortiz, what about that? You know, when people say it's a health issue.
I think there's a lot of discussion around what kind of effect marijuana has on your health. I think there are definitely benefits, and there are some concerns that, of course, we want to address. But the reality is there's over 20 medical programs throughout the country, and all of those programs do allow for cannabis use in order to help with medical problems. We've definitely seen medicine work for folks that are dealing with cancer or chemotherapy or other physical ailments. Young people are able to deal with issues around seizures, and so it's already been proven that there is some efficacy. What we would need to be able to prove that, though, is the ability to research it.
Yeah, Mr. Welch, people are smoking it anyway, as we know. I mean, it's out there. It doesn't take much to walk through someplace and smell it.
Yes.
So how do you respond that they're doing it anyway? So the state might as well make some money on it and regulate it.
So I don't think the state should make money on it just because people are smoking it. The health, you don't get away from the public health hazard. Yes, it's being used medically in some cases. We don't know which diseases or conditions it's going to help for. I agree research should be done. We've got the cart in front of the horse.
Do you believe it's a gateway drug?
I do. And I'm not the only one. There's an organization called mom.strong, momstrong.org, where it's without a doubt. I mean, you need to go to that website and see it. You can go to our website and see the lists of research that is already done, where psychosis and suicide and problematic mental health issues are enhanced, not helped. And until we know what those are definitively, it's irresponsible to legalize it for everybody, allow big money to come into the state, open up retail stores, and start telling our youth that it's okay.
You disagree with that?
Absolutely. I mean, the Department of Health has determined certain ailments that can benefit from cannabis use, and we've seen that throughout the country. So doctors have approved this plan to be able to help certain ailments. And I think when we talk about the economic impact and the social impact, we have to include the negative impacts of incarceration and arrests on our communities of color. We've seen thousands of people pulled out of their homes and put into the incarceration system, and that negative consequences is something that we want to stop happening to our communities. And one of the ways to do that is to legalize cannabis.
Do you believe it's a gateway drug?
I do not, and I think the science is with us that it is not a gateway drug. We see folks that are young have ways they want to cope with different problems, but cannabis does not lead to more extreme addiction issues. And actually, if you look at Colorado and many other places, any place that has legalized the medical use of cannabis, opiate deaths have gone down.
Mr. Welch, do you believe, well, walk us through what your group is doing to try to lobby lawmakers to vote against this.
So we're a grassroots organization until this issue focused strictly in the community of Wallingford, but we've gathered together with 15 other coalitions like ours to spread the word, to educate people. Our attitude is that educated people are going to make educated decisions. And if they know the truth about this, that they know that the perception of harm and the unintended consequences that are associated with legalizing it are detrimental to our youth and our families, they won't be in favor of it. As a matter of fact, I would love to see it given to the people now, because our belief is that most people do not want it legalized. We're not talking about just the legalization. We're talking about the commercialization of marijuana and big pot money coming into our state and adding additional misconception that this is safe. It's not safe. Legal doesn't mean safe. Jerome Adams said that when he was here just a couple days ago.
Yeah, Mr. Ortiz, how widespread is marijuana smoking and who is smoking it?
I mean, all communities smoke marijuana equally. It's hard to say who exactly is using it, but it is clear that over 70% of Connecticut do support the legalization of marijuana. So I'd be happy to put this to any kind of public test because, as we've seen in every state, the community is with us. It's the politicians and the policymakers that are lagging behind the people of Connecticut.
What kind of people smoke marijuana?
Everyone smokes marijuana, I would say. Everyone
Well, I mean, not everyone, but...
Not everyone, but all types of people, all communities. We have many folks that are artists and creatives and entrepreneurs that use it for sure, but also our senior citizens. Our senior citizens are using it in both legal and illegal senses, and I feel like by denying a lot of our senior citizens access to life-saving medicine, we're turning them into criminals unnecessarily.
Jason Ortiz, Ken Welch, we thank you for being on the program, and we want to hear from you. Go to my social media, let me know how you feel about this. We thank you so much for watching Face the State on this Sunday morning. CBS Sunday Morning with Jane Pauling is next.